Hospitals. We think of them as places for healing, for care, right? But here's something that might make you pause.
Hmm.
They often have this massive, unseen environmental footprint. It really makes you wonder, can a place that's all about health actually be green?
That's a really critical question, and it's exactly what we're digging into today. When we talk about a green hospital, what we mean is a healthcare facility that really integrates the environment into its services, quality services. So that means looking at, sustainable design, using water efficiently, energy efficiency, clean air, the materials they use, and crucially, waste reduction. Because, well, the sources are pretty clear. Healthcare waste is a big environmental issue, a potential risk to the whole ecosystem.
Okay, right. Let's unpack this a bit more. Our mission today is to really explore a systematic review, which, pulls together lots of studies to give us a clearer picture. This one's by Lattanzio and colleagues from 2022. It focuses right in on waste management and healthcare, and we want to pull out the key challenges and, importantly, the solutions for you. So to really get a handle on this, where does all this waste actually come from? What the study shows, and this is pretty striking, is that operating rooms are just huge producers, like 30 to 70% of all healthcare waste.
Yeah, it's a huge range, but even the low end is significant.
Exactly. And it's not just the amount. It's how complex and sometimes hazardous that waste is. It needs very specific handling. Think about this. Neurointerventional procedures, they generate an average of 8 kilograms of garbage per case.
8 kilos, wow.
And it's not just the ORs. Hemodialysis, that's another one, between 1.5 and 8 kilos per session. Even everyday things like eye drop prescriptions or disposable diabetes devices, needles, test strips, pumps, it all adds up. It shows how widespread this is.
And what's interesting is how the research often points to the 5 Rs rule to tackle this: reduce, reuse, recycle, rethink, and research.
The 5 Rs, right?
But, it's putting it into practice that counts. There's a really powerful example from the Cleveland Clinic. They have this physician-driven protocol, right? And get this. It diverted about 1 million pounds of plastics from landfills.
1 million pounds.
Yeah. And cut regulated medical waste by 26 tons a month. The key thing there was that the doctors and nurses were directly involved, not just top-down management. That really drove the success.
That's incredible. A huge impact. So beyond these kinds of actions, what about bigger picture strategies? What else did the review find?
Well, moving beyond the 5 Rs, the review really stresses how vital education is. For all health staff and managers too, it actually found that a lack of knowledge, something like 60%, is a major barrier to getting sustainable practices going.
60%?
That's a lot. It is. And then, thinking bigger picture, effective waste management also needs clear rules from the government. Regulations to encourage everyone to follow suit. The idea of having an environmental greening team inside hospitals also comes up, to build that knowledge and push green initiatives forward. And then there are more innovative things being explored, like using math algorithms to optimize supply chains, or even advanced tech like decontamination and pyrolysis.
Pyrolysis, what's that quickly?
Oh, right. It's basically heating waste, like plastics without oxygen. It breaks it down chemically. Pretty advanced stuff for certain waste streams.
Okay, so there are solutions, but it sounds complex. Facilities are juggling a lot. Which brings up the COVID-19 pandemic. How did that impact all these greening efforts?
Yeah, that's a really important point. The review shows COVID definitely slowed things down, at least temporarily. I mean, think about the explosion in demand for PPE, personal protective equipment. It was unavoidable. Just N95 masks alone, the estimate was they generated something like 37 million kilograms of waste in the U.S. in just 6 months.
Wow. 37 million kilos.
It really forces you to think, how do we balance immediate public health crises with that long-term environmental sustainability? It's a tough balancing act. And connecting this back to climate change, medical waste really acts as an influence multiplier. It makes existing environmental challenges worse. Plus, there's the economic side. Hospitals generate about 1.5 billion kilograms of solid waste every year. That costs money to dispose of. But the flip side is waste reduction efforts. They can lead to pretty significant savings down the line, even if you need some investment up front. So it's not just environmental, it's financial too.
So this deep dive really shows that tackling healthcare waste, well, it's complex. It's got many factors. It demands a multi-step approach, doesn't it? From just basic awareness right through to embedding environmental thinking into hospital budgets long term. We started off asking if places of healing could actually harm the planet. what we've seen isn't just the scale of the problem, but also that innovative spirit pushing healthcare towards, well, a greener future.
Absolutely. So the question for you listening is, what stands out to you? Think about it. Recognizing healthcare's environmental impact isn't just some superficial green trend. It's actually about driving towards more responsible systems, more efficient systems, and ultimately healthier systems for all of us, really transforming healthcare's footprint on our planet from the inside out.